So this is the sobering part of breast lift or mastopexy. And I have to preface this with the fact that I have never had a patient that after this discussion has made a decision not to proceed with the procedure, even though this is very serious stuff. This is the serious part of the procedure. A patient who undergoes mastopexy has to accept several things. First of all, you are guaranteed to have some significant scars. Now, those scars generally will fade to almost invisible in the majority of patients by 6 months to 1 year. Some patients that doesn't happen. What we do is minimize the length of those scars, and that makes that whole situation more acceptable. We will go over with you exactly where the scars will be on your breast, and we will explain to you that there is no way, and there will never be a way for us to avoid a minimal scar pattern. So that's something you have to accept. Secondly, infection may happen. There's a lot of incisions with breast augmentation. These infections are generally very minimal, very superficial, and don't end up putting the implant itself at risk. We've never seen that, but it is possible, and we have to talk about that. Next, we have to talk about perhaps one of the most serious aspects, and that is the fact that you can pop a stitch, you can have some tissue that will actually become devascularized enough to what we call necrosis. It really is tissue death. And that can be just the edge of one of the flaps, or that can actually be the entire areola and nipple. We've never had that happen with our patients, but we expect in a busy practice that someday we will. There's reconstruction that's available that gives a very satisfactory result. We hope that you're never the patient that has to go through that, but we fully expect that good surgeons across the country have this happen. We do everything to help prevent that, and we'll talk through those prevention measures, both the things we can do and the things that you can do to assure that you're going to have a smooth recovery and have an excellent result should you choose to pursue mastopexy or breast lifting.